Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hey guys, do I have the episode for you today? I have the MILF maker herself, Dr. Wendi Grunberg out of San Antonio, Texas, on the show today. Thank you so much for being here.
Thank you for having me. And we are going to talk about sex, baby.
Yes, it's time. I'm super excited to have you on. And this topic, I mean, who would be better to talk about this with me than you? So sex after surgery, we both know is a super important topic. And I'm really going to let you kind of take the lead on it because you're the expert.
Thank you.
When can they have sex after surgery? Why can't they have sex after surgery? How long should they wait?
I think it's going to be dependent on what type of surgery you have. So I think, let's just say we start off with like a breast augmentation. I tell patients no sex for 6 weeks. And normally people will start to get a little bit frisky, horny. I usually see it around week 3. But if, let's say you have sex a little bit too soon, I've had a couple patients who've had sex injuries, whether it's a hematoma, especially if you're doing like a dual plane or a submuscular. The way I explain to them is that I'm cutting through your muscle. That's a raw piece of meat. You can like bear down, change your blood pressure, and you may bleed. And if you bleed, you're going to get like periprosthetic hematoma. That can lead to early capsular contracture. That can lead to an infection because that blood is a nidus. Like bacteria love blood. It's called like a chocolate agar in the lab. And that's one of their like favorite things to grow on. You can have injuries. And I've taken people back for literally just not responding or not listening. And the way it goes is that, all of my preferences for sex will literally go along with wound healing timeline. So at 2 weeks, your wound is the weakest. Why? Because your body is now starting to eat the sutures that I put in. So it's only 20% of the wound strength. At week 3, it's 30%. Can you imagine having sex at week 3? You can still rip everything apart. Week 4, 40%, super easy. Week 6 is 60%. And week 8 is 80%. That's the most amount of strength your wound is ever going to have. It's never going to get back to that original 100% at all. So by week 6, let's say for a breast augmentation, I tell people safe positions. I think missionary is going to be the worst. You don't want somebody like laying on top of your
fresh boobs.
Yeah. Or you're going to have to do it sort of like a seal, which I don't know if that's good for some people. If you're going to do missionary, like let's do it right, where you have some like body weight and stuff on you. So doggy style, excellent, because there's not going to be any pressures on the boobs, but I recommend that they wear a bra so the breasts aren't swinging and sort of moving around a little bit too much.
Keep them snug.
Is great. Yeah, keep them snug. Standing sex is great depending on like penis vag height if you're going to match up. A woman laying down on the bed, man standing, and even just like regular like spooning. But I do not recommend anyone placing their mouth on a woman's nipple areola complex for at least like 3 months or so. So I always tell the women, just wear a bra, wear some lingerie. It's okay to have somebody grab your breast, but don't put their mouth on it because there's so much bacteria in that. You don't want that to get to the implant at all because that capsule is still forming.
I think I told a story in a previous episode of one of my patients confiding in me after her infection that she thinks it was from her husband sucking on her nipples.
Yes. Absolutely, because they're really, really sensitive. Most of my patients get hypersensitivity for about 3 months. And for some people, you haven't had that much sensation. For most of my women, don't have that much sensation. And then, the implant goes in and now you're suddenly sensitive. So, but it's best to like stay away. And I mean, if people want to I say it's fine to, I guess I'm just going to be really explicit, ejaculate on your chest. That's perfectly fine. I don't think anything is going to happen with that, but no mouth to nipple areola complex. Tummy tucks are almost going to be the same. I always say around 6 weeks, again, safe position. Missionary is the worst. Sex swings will be really good because you want to do things that aren't going to be sort of flexing your core. Oh, if we go back to the back to like a breast augmentation, a woman being on top is also a very bad position, because if you're posting sort of or holding yourself up with your hands, that's a lot of pressure on your pectoralis muscle. There are only a couple people that I'll allow to be on top, and they're usually in the adult entertainment industry, and they have very strong leg muscles. So they actually don't need to use their hands too much. So those patients are allowed to be on top.
Goals.
But
that leg strength.
We're like, no hands. I think sex swings are great because the woman can be in a sex swing, especially for like a tummy tuck, and you're not putting any pressure on your core. So if you do like a good, let's say you're starting to have sex at week 6, remember that wound strength is only 60% of what it's going to be. It's good to put a little bit of stress on it, but this is almost like a get in like less than 20 minutes, because it's also a bit of cardiovascular, a little bit of cardiovascular strengthening. You haven't done anything, hopefully, in about 6 weeks or so. So you're pretty deconditioned. But similar positions, doggy style, spooning, standing, laying down on the bed. I think those are good. I find that people who don't listen and start to have sex at week 3, they're the ones where they're like, why is my hernia back? Or why do I have a bulge? And I was like, what do you mean? You have a bulge because you decided to have sex at week 3. So I tell the patients it's okay to start masturbating. You're going to get frisky. And they're like, no, I'm not. I'm like, yes, you are. It's okay to masturbate. No mutual masturbation, because I know what that leads to. And then I'm like, just kick it old school, hands and like a quick vibe. If they're like jumping and mounting on top of somebody or on like a Symbian or something like that, I would say no to that. Just like a quickie, will release the stress and then move on with your day.
Get it done and then move on.
Yeah. And then they're like, well, my husband or boyfriend can't wait. And I said, well, there are plenty of sex toys that you can get for him. The lights are great. They have these like masturbatory eggs that you can get someone. And then they're like, well, what if I give him a blowjob? And I'm like, well, I don't know. For me, if I'm giving a blowjob, I'm using my core. I said, that's not going to work either, unless you're like your head off the bed and you're not engaging your core. So I was like, you have to wait for that too.
You're so right.
Right. But I go through all of this stuff because I don't want anybody to, to mess up along the way and be like, you didn't talk about it or you didn't tell me. I didn't know. And at 8, you can swing from the chandeliers, do your thing. And then we can talk about bondage after.
No, this is all really good. So 6 weeks for breast augmentation, 6 weeks for tummy tucks. What if they only did lipo? What if it's just like lipo 360 BBL?
If you add a BBL, then no counter sex, it's going to be no missionary. It's going to be face down, for lack of a better term, ass up type sex. And I usually let them around week 3, but not a lot of butt play. Like not a lot of like manipulating, smacking the buttocks or things like that. No paddles, nothing like that.
If you're going at it at 3 weeks, stay in your faja. I'm sorry, y'all. Just stay in your faja. They have openings.
Yeah. Unstrap, undo the crotch strap at the bottom if you need to, and then you're back in your faja like immediately, and you're restrapping in because you're going to swell after sex.
You are going to swell. So I think that this is a good chance to talk a little bit about what can they actually do when they engage their core during sex after a tummy tuck to the work. What can they do? What is it that makes the bulge come back? What happened?
I think it stretches.
Do you think it's suture popping?
So I've had one patient, super petite, husband, super machismo, big guy. And it's the only patient I've had to take back. And she's like, it looks like I have a pot belly. And I used Ethibond suture, Neurolon, depending on which hospital, like either Neurolon or Ethibond. And then I oversew again. So like, I think it stretches. So I went back in. She's like, why do I have this bulge? And she's like, and I was like, well, you just decided to tell me like in the pre-op holding, like for the take back, that your husband really wanted to have sex at week 3. So I go back in, everything looked fine, except I had to retighten, didn't see any of the sutures like popping out, like everything looked normal, but I had to do like an onlay mesh to reinforce her abdomen.
This is interesting. Okay. So it looked like something happened. And then when you went in there, you're like, okay, I'm probably going to find a pop suture or something, but nothing. Yep. It wasn't. It was just stretched.
Yep. Everything looked right. It just re-stretched and it looked like she had just like a baby pot belly, like a little pooch at the bottom, almost as if I never I
Like
never did anything.
Wow, that's really
But
interesting.
I didn't see my neurons and I see my ethibonds. We know those are permanent suture. Nothing. I even like made her cough in surgery, like cough stimulated her. Nothing. It was just a stretch. I'm almost like was like, why am I here? And then I tested every single muscle, fired every single thing, and then realized that I'm like, I just have to enforce it. And then I put her on like a bunch of sessions of Evolve afterwards to help her engage her core, to help like strengthen her core. So like now most of my pre-op patients, I have them start planking a couple of weeks before surgery to strengthen the back and core, because you're not going to be able to do that for at least like 6 weeks post-op.
Beautiful. So whenever you tell your patients to plank, what are your usual instructions in case anybody listening wants to do this?
I mean, hold it as long as possible. Try to get up to a minute. Once you get up to a minute, then try to do some of the fancier movements like hands down to the elbow, crossing, start lifting your legs and stuff like that. The patients who actually do it have a very easy post-op course and they don't have the back pain, and the patients who don't do it.
Oh, you just touched on something that I don't think we've talked about on the show yet, which is back pain after your tummy tuck.
Yep.
So
it's not the belly that hurts, it's the back from being bent over.
That's exactly right. You're walking around kind of like an old grandma hunched over. I like to tell my girls to, if they're going to be walking around somewhere, to hold on to a pillow and walk like an old lady and take their time. But that back pain is really
awful.
Mm-hmm. It does suck.
But the fit girls are the ones who like actually work out before surgery and listen to, pre-op advice. It's not as bad. And then the other thing I started to have people doing is when I realized, like after I had my lipo, when you're in that faja the whole time, you know how we're always taught to like suck in a little bit.
Mm-hmm.
Like when you're swinging the faja, that's doing that for you. So then I gave out on my faja and I felt like I had like a blown out core. And I'm like, oh my God, I haven't been doing my isometrics. So I'll have patients start doing some contractual isometrics around like week 3. Just suck in, hold it for 10 seconds, and then just let it go like in their fajas to start to sort of maintain
engage that
muscle.
core.
Yep.
Good. Okay, I'm doing it right now.
Me too. As I'm talking to you.
Let me do it while I'm sitting here.
Yeah.
Okay, so you guys, I hope y'all are taking notes, because this is why I love having you on, Dr. Grunberg. You're such a fountain of knowledge, and I love getting this insider info, because like unless you tell us, we don't know that it's just stretching it. Nothing even popped. It just stretched back out, and that's possible. So that is why you have to wait. I know y'all want to get frisky. You're like feeling better. You're starting to feel better after surgery because you are getting like through your recovery, but also you feel better, like looking in the mirror. You're like, oh yeah, I like this. And of course, your partner or your spouse wants to engage with you, but you guys, you have to put a boundary up. Hey, I understand. I know, but you only have to wait a little bit longer. Yep. Only until 6 weeks.
Exactly. The patient who had, I'm going to call it a breast implant sex injury, it's also going to cost double to fix because you have to put mesh in. I had to go back in, figure out what the heck was going on, redo the IMF, because she's like, I felt it pop when she was having an orgasm on top of her husband. She also lifted that day, and she also vacuumed, which is a major no-no because all of those things are pectoralis muscle related. So then she had some like weird, it was almost like a hematoma type thing delayed. And then it started to absorb. But as the breast was sort of settling into place, it started becoming super lateralized. So I had to go back in, change out the implant, wash everything out, and then put a mesh.
And those,
it takes a lot.
Yeah, it's a lot of work. It's more expensive now. Remember, you guys, when you go back in for any type of revision or like going back in to fix something, it's going to cost you. It's not for free. You still have to pay the OR. You have to pay your surgeon. If you have to get new implants, you have to pay for new implants. If you have to get mesh, you have to pay for the mesh. So it's better just hold on. Just hold on a little bit.
That's why just masturbate at week 3. That's it. You're good.
Maybe I'll put a vibrator on my Amazon list.
Yeah, one of those little like lipstick ones or something that'll be like really cute. I think people who do tell me, they're like, you know what, you're absolutely right. By week 3, I was dying and I took care of myself and I feel a lot better. That's it.
Perfect.
And then it's in just for a couple weeks. But I've operated on nurses, ICU nurses, and they're, as a physician, even myself, I'm like, that's not going to happen to me. Or like, that would never happen. But then I have people, I'm like, why is your umbilical hernia back? I did a primary repair. I know my repairs are sufficient. And they're like, oh, well, I couldn't wait. I just really needed to have sex. Oh, the hernia's 8 weeks. No question about it. If there's an umbilical hernia, you're waiting 8 weeks. So remember, she had sex at week 3. She probably popped some of the sutures, and it was PDS suture.
So those are tough to pop.
Correct. And her hernia came back and she's like, can you fix it? I go, no, you now have to see like a general surgeon and get this fixed because you failed primary repair because you're unable to listen to instructions. And I'm not taking you back to the OR for that. That's it.
Sorry, you lost your chance.
Correct. People who have like re-widened, I have one patient and I just know, when you know that someone's not like telling you the truth.
Yes.
She was like my child punched me. I was like, I've seen your kid. They're like 5 years old, like 40 pounds soaking wet. And she started to develop a supraumbilical widening of her diastasis again. And then so I started putting on Evolve machine to try to strengthen her core, going back to that stuff. I mean, it's better, but she would need to go to the OR again. She's like, well, how do I fix it? I said, I have to literally lift everything up and redo your tummy tuck and redo the whole diastasis repair. And she's like, my kid punched me. And I was like, I've seen your husband and how you guys are. I mean, it's super cute, but I was like, you got punched with something else in your vagina.
You got punched with something else.
Yeah. Mm-hmm.
So waiting is definitely going to be your best bet. And I think this topic leads to another really interesting topic, which is birth control. So birth control for tummy tucks specifically. And I guess for all of the mommy makeover procedures like tummy tuck, breast augmentation, lipo, what is your recommendation for birth control before and after?
Pros and cons. Pros, they don't get pregnant before surgery.
Yeah, because how many times have we heard, I'm pregnant, I have to reschedule my surgery? Yeah.
I've had a couple patients with that. So I think like new literature says you can probably keep them on. Most of the people are going to be on like low estrogen. I've had all of my patients with a tummy tuck. So let's talk about like Caprini score. Caprini score is just like a risk stratification. When I look at you as a patient, we calculate how many points and what your risk factors are for getting a blood clot. If you're young, surgery is less than like 45 minutes, no medical problems, you get a 1. But let's say anytime you're getting a tummy tuck, that surgery that's going to be over 45 minutes, you're getting 2 points for that. And then you're going to be a little, not immobile, but you're not going to be able to move around as much. So you're already in like the intermediate risk between like 3 and 7. You're already at a higher risk. And I think there was like a study, I think when I was studying for my boards, when they're like, these are the patients between 3 and 7 who are getting the blood clots, who are getting the DVTs or the pelvic like thrombi and getting the PEs. So all of my patients, they're up and moving. We do deep breathing exercises and everybody gets SCDs to go home with. And you're wearing them until you're up and moving as much as possible. So everybody's on it for 5 days. A lot of people do like therapeutic or like on table heparin. I don't do that unless the patient's had a history of, let's say, history of PEs, history of like DVTs, and then I'll consult with a hematologist to make a perioperative plan. I mean, I've operated on people who are anticoagulated because all bleeding stops at some point. But I'd rather the patient, and it's just done by each. We talk to the patient. Sometimes, like Dave and I were talking about that before, it's the story. And you're like, I really want to help this patient because they're trapped in their body. And let's just figure this out together. And we have to know you may get a PE after surgery if you're already high risk for it. So it just depends on the patients. And then you have to pray to the gods, both old and new, that everything's going to be okay.
Absolutely. And you guys, right before we jumped on the call, on this interview, Dr. Grunberg and I were talking about what we love so much about what we do. And she was telling me, that for her, it's really important for her to meet her patients and get to know, like, where are you in your life? What are you doing? Like, really build a relationship with her patients. And I had mentioned to her, if you guys didn't check out the best of 2022 plastic surgeon list, go to my IG. It's the Big Butts No Lies podcast. But Dr. Grunberg is the only female in the high BMI list. And we were talking about that. And she was telling me, a lot of surgeons turn away high BMI patients And Dr. Grunberg opens her arms wide.
Mm-hmm. And sometimes it'll just take more than one surgery to get there. But you just need to know people's goals, and you guys you and the patient have to have the same vision for their body. Not everybody wants to be a size 6. A lot of people want to maintain their like thick girl realness and curves. And I love that. Absolutely love that.
It's beautiful. And for our high BMI girls, give Dr. Grunberg a call. She will take care of you. And you are 100% right, because I've had people reach out to me who tell me like, hey, can you do an episode on big girls who want to stay big? They don't want to be tiny. They just want to be shapely with whatever the size that they are. And that's exactly what you're talking about. It's beautiful.
I have a bunch of like super curvy butts are just God's gift from the universe. And they want like smaller waist and just like a little bit of contouring. I love doing that. And sometimes their BMI is above 40. So
you just, whenever you have the high BMI girls, you take is it extra precautions, or you just come up with, of course, every patient gets a customized plan, but for the high BMI ones, is there things that you do differently?
No, they're the same.
Beautiful.
It would just be, it's the same. So I recently lost some weight, but I'm going to say like 2-3 months ago, I was obese according to BMI. So who am I to judge?
I know. Tell me about it.
It's stupid. The only thing we have to know about, okay, do you have obstructive sleep apnea? Do you wear a CPAP at night? Is it safe to put you face down for this portion of the surgery? Or should we, let's just start with the front. And then once we lower your like risks, the things that you do have to pay attention for is, we know in literature, a BMI above 36 means you may have some wound healing complications. So you'll get some possibly fat necrosis, wound breakdowns and stuff like that. But I also like look at a patient. If I have some patients with, like I said, huge buttocks and thighs, and their breasts are seemingly small, why can't I do a mastopexy on her and know it's going to heal fine? It's fine. I do talk to them and say, like, you may have wound healing risks, but if it's worth it, let's do it. And they're like, okay.
Yeah. And they're like, do it. I don't care.
Mm-hmm. To be honest, I really haven't had any problems. Knock on wood.
That's beautiful. I love that. And before I let you go, I do want to talk about nipple sensitivity after breast augmentation, breast lift, breast reduction. What can girls expect as far as their nipple sensitivity? And I'll tell y'all my personal experience.
So I tell patients, if you're able to orgasm through nipple play, because about like 2% of the population can, or that's something that's the only way that you can orgasm, then I'm not sure breast surgery is worth it for you, because I think that's a good gift. If you still want to proceed, then let's start with the breast aug. I tell the patients, if it's not the only nerve to your nipple areola complex, but if the nerve is in the way of where I have to put the implant, I'm cutting it. There's no, I'm not going to stop mid-surgery. I'm cutting it and we'll see what happens. Generally, you can get some neuropraxia because the nerve is generally off to the side when you sort of sweep it out of the way. So neuropraxia just means the nerve is intact. It just gets stretched, and it'll just take a little bit for that nerve sensation to come back, anywhere from a couple weeks to a couple of months. And it's known by it'll be at night, of course, and you'll be electric shocks to your boobs, radiating towards your nipple will happen. I don't know what has to happen.
Something like that.
Yeah. So I'm going to say most of my patients, I can only count a handful of patients who don't have nipple sensation. Even the ones who orgasm through nipple play. And I've just taken the chance and being do not kill me if something happens, but they're fine. So breast augs for most of my patients, it's going to be that hypersensitivity for 3 months. Sounds sexy, but it's usually not. And then it'll start to settle out. If they don't have much nipple sensation, then sometimes I think everything evens out by month 6 to 9 type thing.
Yeah, I think so. So for me, initially I had a lift. So I had the scar around my areola down the front in my fold. And for me, it probably initially you're 100% right. They were hypersensitive. In the shower, I could not let the water run or hit me straight to my chest because I was screaming. They were so sensitive. But it's awful. But after probably I would say 3 months on my right side, it came back 100%. And on my right side, I feel probably like maybe like 80%. 80% came. It's still fine. And I still feel everything. It's just a little bit slightly different. And I did tell her before my surgery, I was like, please save my nipples. Please make sure I have sensitivity to my nipples. Don't take it away. And she was like, I'm going to do my best. I'll try my best, but I won't make any promises, which, I mean, try your best. That's all I can ask for.
Yeah, I think with the mastopexy, depending on which pedicle you use. So if you get like a superior medial pedicle, I always tell my patients, because I like the way the breast looks with the superior medial pedicle. I think the fullness
That's
is
what she did.
Yeah. So I think you're going to maintain the sensation. But for my patients, I tell them your nipples are going to be erect for 3 months straight, no matter what.
For real.
Yep. And eventually they'll go down. But I'm like, well, if they're erect, that means they have some nerve innervation to them. So that's good. And I'm like, it's just a hurry up and wait type thing.
Hurry up and wait.
But,
and
yeah.
They definitely do feel, it does feel like kind of like electricity or like, I'm trying to think.
An itchy scratch sometimes.
Yeah, like an itch, but it's also sensitive. Like you don't really want to touch them. Like at one point, they were so sensitive, even in my bra. Like even in my bra, I was like, oh, I had to put like paper towels to protect them.
Yeah. So I have my patients, is something, we learned in training for like touch therapy for fingertips. So I have my patients do touch therapy to their nipples. So you start with something super soft. Like this is going to sound nuts. And I'm going to say it like a rose petal. It's very soft. Take the rose petal or a super duper soft pair of like satin underwear and you rub that on your nipple. And you rub on your nipple and then until you can't feel it, kind of like your clothing's on you and you don't recognize or you don't think about your clothing touching your skin all day. So once you can tolerate that and it doesn't hurt, I mean, it may take a couple of days of just rubbing that. Then you move to something like an Egyptian cotton and then a cotton. And then you eventually work your way up to like a jean. By the time I've mentioned that to people, nobody ever complains about it again.
Yeah.
So we do nipple touch therapy.
Perfect. Nipple touch therapy. That I hadn't heard of that before. So that's amazing. I'm going to suggest that now. I'm definitely going to suggest that.
It sounds crazy when you're like, take a rose petal and just rub your nipples gently.
This is why I love having you on. Okay, wait. Before we go too far. So birth control after surgery. So tummy tuck. What about for tummy tucks?
So if they have implantable devices, then it's going to stay in. And it all goes back to that Caprini score and risk stratification. If they're able to come off of it, if I know it's going to be a very long case, like a 6-hour case, I ask if they can come off of it at least a month before so they can stay on cycle. And then they can start it at least like 2 to 3 weeks after surgery because they're going to be up and moving. If the patient's like, I have to stay on it, then they have to stay on it. It's not as bad as we once thought because everyone's on the very low estrogen. IUDs stay in.
Well, that's good to know because I know previously it was kind of like get off your birth control, stay off of it for at least a month after surgery, and then you can get back on. But now it's kind of like, it's not so bad.
It's not so bad. I mean, if it's something that they're able to come off, because some patients are like, I can't, I will get pregnant in 1 second. What do you tell them? You're like, okay, we'll just figure this out. You better be up and moving. You better be walking around. You better be taking care of yourself. You better be wearing your STDs. And then I also listen to my gut instinct, which has no science to it whatsoever. If I'm on the table, I'm like, something doesn't feel right. What's the big deal to give them a dose of heparin?
Beautiful. That's why you have to trust your surgeon. You guys, when you trust your surgeon, like you're trusting them, their expertise, their gut. They're going to go with it. Follow what they know to give you the best result and recovery.
Yes, absolutely. Absolutely.
Okay. So on Instagram, we had some questions submitted. So how about you rapid fire answer them for us?
Okay.
So this one says, not exactly about sex, but does surgery usually throw off your cycle, period, ovulation?
Yes, all of those things. I find that most of the women I operate on get their periods the day of surgery. And they're like, I have my period. I'm like, everybody gets it. I think it's stress. And then they'll lightly bleed, spot for a couple weeks. Either they'll skip the next period or they'll get their regular periods. 100%.
It does throw you off a little bit. I hear it all the time from my girls where they're like, I haven't gotten my period. I've also, and give me your opinion on this. I've had girls who were like, oh, my libido went crazy after surgery. And then I've had some who told me like, oh, my libido went down.
Yeah. Both. It just depends. I think that has to do also with what surgeries and where you are mentally. Because I think you and I have spoken about this, and I think we said we wanted to do something. There's a sadness that can come with surgery.
Let's talk about it.
Yeah. So I always tell patients around like I'm going to say like week 2, week 3, even like at the end of week 1, just depending on some people. Some people get really depressed after surgery for like, I didn't think it was going to happen to me. And I was crying like a little bitch. I was like, why did I do? It's like, why did I do this? I could have used this money for something else, like for the greater good of like the universe. Or if you have kids, I should be spending this on my children, something like that. And then you start looking at Instagram and you're like, why did she look like that in week 2? And I look like awful. Yeah. And I look so swollen, and everybody's different. I tell people, I'm like, do not compare yourself. You guys don't have the same genes. You're not going to, if you're one nationality, you can't compare yourself to like, look at my page and be like, oh, look at this like skinny Vietnamese patient. That's not real life. You're never going to heal like that.
That's not. And you guys, comparison will dampen your recovery. I always tell you guys, do not compare yourself to anybody, not even when you're doing your research for surgery and you are looking at before and after pictures. I know y'all are looking at you're looking for pictures of somebody that could look similar to you, and y'all are looking at stats and how much do they weigh. And I just want y'all to always remember that even if the 2 people weigh 150 pounds, what is under their shirt when they lift it up can be completely different. One can be, Dr. Grunberg, like one can be 150 pounds, but she lost 100 pounds, right? So her stomach is going to look different, like loose skin, probably an overhang compared to this other person that's 150 pounds, but they just gained 25 pounds and now they're a little bit thicker. So you cannot compare yourself to anybody.
Never. No, just compare yourself to either yourself. And I always tell people before surgery, did you take pictures of yourself? If not, I'm going to send you your pictures, because there's going to be a moment where you're going to be really upset. And I need you to go back and compare yourself to how far you've come. I think my surgeon did that for me, because he sent me, I'm like, who the fuck is that? And I was like, oh, shit, that's me. I don't remember her. I was like, we don't know that bitch anymore. We do not know her. She has left the building.
She does not live here anymore.
She ain't welcome here either.
You know what's so funny? I've had probably like the last 2 recovery diaries where my girls are like, I had to learn that I'm not that girl anymore. Like the person I was before surgery, like I'm not her anymore. And it's so, I love it.
It takes a year, I think, especially if you have like a little bit of body dysmorphia, which I definitely have. And I know that's crazy in itself, but it takes like a year, because I was still wearing the same clothes from before. And someone's like, you need to get different clothes, honey. Like, this isn't a good look anymore. Like, you need to not be wearing your big girl pants, because you're not that big girl anymore.
Oh, but you dress so good. You look so sexy all the time. I'm like, dang, Dr. Grunberg.
Now I do, because I like to show off my curves.
Now you're like, I got them, so I got to show them off.
Absolutely. Serving curves. Ooh, I did think of something about when it comes to sex. And I think you posted it as a question, so I may be stealing your thunder.
Go. I was about to go through with the next questions. Next one is, will orgasms change after a tummy tuck with muscle repair? Yeah. And if yes, why?
Yes, almost all of them. So especially if you have like a ptotic mons or like a droopy mons region or full mons. So just think about the orientation of your clitoral hood. She's down, she's sad, she's pointing towards the center of the earth. When you lift that, your clitoral hood is going to be more exposed for sex, especially when you're on top. So I have multiple people telling me they're able to orgasm easier when they're on top with their partners, and they can even get multiple orgasms now.
Because you guys,
more clitoral rubbing.
Yeah, there's more availability. Like there's no hooding there. There's nothing like in the way. Because you guys, after a tummy tuck, I can't tell you how many times I've heard my girls, and I experienced it myself when I sat down to pee that first time after my tummy tuck. I was like, oh my God, I can see my vagina again.
Yep. Yeah, you can see your vagina. Stream may change just a little bit too. I had one girl I did a tummy tuck to. I wanted to, like, she's hilarious. She's like, She was a massive weight loss patient, like 200 and something pounds, staged her, super curvy, one of my favorite bodies. And she was like, I went to go put my tampon in. She's like, my hole was in a different spot. I was like, get the fuck out of here. She's like, I almost ended up in like my taint. She's like, because everything was just pulled a little bit tighter. And I was like, ma'am, you didn't have that belly to reach around. She's like, no.
She's like, it's in a different spot.
Yeah. Yeah. But everything gets like pulled up. So you'll have more surface area contact of your clitoris.
Absolutely. Okay. The next question is, can I become loose again after a vaginal rejuvenation? So talk about vaginal rejuvenation first.
It depends what people are doing. Are you doing surgical, non-surgical, O shots, perineoplasties?
I think probably like the vaginal. For this one specifically, I think she's having a vaginoplasty.
I tell everybody this. It's kind of like when you drive a car off the lot. It's already old. Like you're going to continue aging around it. Everything can stretch out. Absolutely. So you may have to do, let's say, like maintenance treatments, whether it's going to be the Diva or the Votiva, or just getting like regular O shots to increase stimulation of your collagen. You stop making good collagen around like 25 or so. Or like fresh collagen. So without any type of injury, you're not going to tell your body, hey, let's make some good collagen. Let's sort of like spice things up, or, start stimulating things like we do it to our face all the time. That's why our faces look good and the rest of our bodies look You're going to have to keep up with it. But if you mean stretching by the means of having intercourse, no. I mean, at 80 years old, everything is going to be loosey-goosey.
So let me tell you guys, Dr. Grunberg mentioned 2 treatments that one was Diva, the other one was Votiva. And these are treatments that you do like you can do it at a spa. Dr. Grunberg probably does it at her office. These treatments you do in and out. I've had one treatment with a machine called Thermiva.
Oh, yeah.
And let me tell y'all my experience, because I think it was we had them a package of 3. So we sold them as a package of 3. I had one patient come in once and she was like, I just do something. So we did the treatment on her. And the next time she came in, because you do a series and you come like 4 weeks later, 3 weeks later, whatever. And she was like, it took me from President's Day. She was like, yay, it's President's Day, to, oh my God, it's 4th of July.
Yep. Yeah, absolutely. Because so Thermiva, you sit there and you're massaging a wand on the external genitalia and inside in like, I'm going to say almost like every hour. So 12 o'clock, 1 o'clock, 2 o'clock, and you want to get the heat. You have to build up the heat. And what the heat is doing is it's stimulating your collagen production when it gets to like a certain degree. So more collagen, more tightness. It'll maybe like increase some of the vaginal moisture as well.
Oh, yeah. And like a slip and slide. If you're having issues with moisture, try the Thermiva. Or any of those treatments.
Yeah. Diva is like a halo treatment for your vagina, and it's by Cyton. And Votiva is like a Morpheus for your vagina, and that's by InMode. I actually don't have those platforms yet.
Yeah. Hey, I want you to take this opportunity and tell us about your new office, because I saw you were moving. I saw all of that happening. I can't wait to come visit you, but tell me about your new place.
I love it. I think I bought a building. And half of it is the, office sort of med spa side. And then the other half, which will probably open up in a couple of months, inshallah, God willing, is going to be, I have 2 ORs. So it'll be super easy. You just walk right across. And I think it's like the embodiment of me. It's gothic chic.
I love it.
Like, yeah. So it has it's very dark. And then it has, a lot of gold accents. And I just feel at home.
Beautiful. I love it. When you post your pictures of you with your staff, it makes me so happy. And I'm like, that's a girl gang right there. I love it.
Yeah. They're my family. And I'm not just saying I work with them. We were talking about it before. Like I literally love all those girls, like love all of them.
And they're such an important part of your practice, because the way it trickles from the top, everything kind of trickles from the top. If the person at the top isn't warm and receiving and kind of kind, like you feel it in the staff. But when the doctor, you can tell when the doctor is really good with their staff, because you can like feel the warmth on the phone. I know when I've called your office, The warmth on the phone, it's beautiful. They always answer on the very first ring. It's perfect.
And I want everybody to be themselves and feel like they can be themselves, because I'm myself in the office and I don't want people to pretend like they have to put on this persona. So like one of my nurses, she's very sexual. She has like a genitalia shelf and I love her to death. She has like her fuzzy butt plug. She has her vulva candle. People get her she has like dicks out. I love it.
Oh,
I got her.
My gosh, I love
I got her a to sort of explain, where the shots are going to go for the O shots, because I felt like that was just the easiest thing to do. All of that stuff's out, and she's very sex positive, and I think that patients love that. And if they don't, then you don't have to go to her. You have to write off.
You know what? Let me tell you that whenever your girls tell me, or whenever they're waiting to talk to you, and they're like, "She's it. I love her." Like whatever it is that she's doing, I stan.
Oh, thank you. I love that. But it's just being me being me, and the staff the same. Like we're literally the same inside the office as we are outside the office. Same amount of cursing, same amount of foul jokes,
the same people.
Yep.
It's the same people. Yeah. And I think patients really enjoy that. They really do.
I usually get feedback. Patients are like, I just feel like I can be myself here. Like, I don't have to be anything different. I'm like, I don't want anybody to feel like that ever. It's like you're most vulnerable when you're getting naked in front of somebody. You're getting naked in front of strangers. Like it's super vulnerable.
It is.
So I want you to feel comfortable.
Yeah. You want them to feel at home in your office. I know what I've heard from surgeons that have come on the show, and they're like, I love having my patients come back to visit me after surgery a year later. Like, I love catching up with them and knowing how their life has changed. What do you hear the most often after women have surgery and they come back to see you? What changes do you see, or what's a lot of them get new jobs?
Yep. Inner confidence. And it was always there. And it's weird to say that something physical changed it, but usually they propel in life. And it's nuts because it's just skin. And I don't know what it is. And even with me, even with my surgery, I'm like, it's the best thing I've ever done for myself. And I just felt like my insides finally matched my outsides. And I don't know why they gave me such confidence to become, to even put myself out there, or patients put themselves out there. But everyone says it's life changing, and it is. And it's crazy because it's just skin. And we're like, oh, just, love your body the way you are. And I do, but there's some people that feel trapped a little bit. My favorite is when the people are like, I haven't taken my shirt off, or I haven't had intercourse 10 years and things change after surgery. I had one patient, I've done her recently. She was pretty much a recluse in her body. I think she was 400 pounds, lost 200 and something on her own. She's one of my stage big girls. And she was out wearing this bodycon dress at lunch with one of her friends. And we were both crying when she's telling the story because somebody came up and bought her a drink. She's like, no one's bought me a drink in 15 years. And I got asked that on a date.
Aww.
And I know. And we were crying and hugging. And it was a beautiful moment.
I got chills. I got full body chills because it's so beautiful. I love hearing these things. In a previous episode, I kind of said it, that it's you get this mental space that you're like, I didn't even realize it was there. At this weight, I didn't even think about it that much. But now that I don't have to think about it.
Right. And that's what it is, especially for a lot of my massive weight loss patients. They would tell me their thoughts every day were about their body image and their skin, and, having to tuck things in, or how to, what they had to think about hiding their body. And now that everything's taken care of, they've moved on with their lives and they feel great. And then what I always tell people is, everyone's like, well, I can't wear that on the beach. I'm like, why? This is either pre-op, post-op. I was like, why? I can't wear that. Well, why? You have legs. Why can't you wear the shorts? And then, what I've noticed sitting on this side of the consult, everybody has insecurities, myself included. And we're all too worried about what other people think of us, that no one's looking at anybody else. We're always like, oh, I should wear this sarong because I have some cellulite. But everybody is thinking that, and no one's even paying attention because we're all too self-involved and too self-critical. Just wear the shorts.
Absolutely. Wear the shorts, wear the bathing suit, wear the crop top.
Yeah. Yep.
Wear whatever you want. If it makes you feel good, if it makes you feel confident and you're like, man, I look good in this, do it. Wear it. And even if you feel like, I'm not sure, what if you wear it out and you get complimented and you're like, oh, I guess it does look good on me. It does look good on me. And then slowly you like start building your confidence back up of what you thought how things were to how things are now. Like, that's not you anymore.
I think seeing my 50, 60-year-old patients in crop tops is my favorite.
Oh, I love it.
Love that. They're like, I never thought I would wear this. I'm like, you better wear it every day because you look amazing.
And you know what? What I hear from my girls, that the changes that happen is a lot of them get new jobs. And like, for example, my episode, Melanie, she was like, I had been working there for like 10 years. She's like, and I wasn't really like unhappy. She's like, but after I had my surgery, she's like, I just needed a change. She's like, and I went and I started looking for another job and I got another job paying me almost double what I was working for somewhere else. And she's like, oh my God, like what? And she got a new job. And I hear this all the time, like, oh my God, I had my surgery and now I have a new job and I get paid this much more money. And it's just like your confidence did that. It's not your looks. It's your confidence.
Yeah. It's on the inside.
It's on the inside.
It was always there. She just needed to be unleashed a little bit.
Let the tiger out. Or let the lioness out.
Yeah.
I love it. Dr. Grunberg, it has been such a pleasure to have you on. You're always so much fun and such a joy. I love watching you on Instagram. I love watching your practice. I love talking to your patients. And if y'all don't know, Dr. Grunberg includes Bruise Juice in all of her mommy makeovers. So, you know, whenever you go over there, she's giving you the top of the top.
I put Bruise Juice on before we started because I saw your before and after of your eyes. So I literally put it on every morning when I have my coffee.
Yes. And how do you love your under eyes?
I love them. And I feel like my skin's been a little bit dry. So I've been lathering and I need to make another order. Yes.
Yes. Yes. I love it. So where can our girls find you if they want to come see you?
I'm in San Antonio in the Chavano Park region, and my number is 210-714-5390. Or on Instagram, my handle is Dr. Grunberg.
And it's Dr. Is it a period Grunberg or is it space or is it all together?
We'll all together. The period is my backup.
Because girl, Instagram, you got to have a backup. Didn't you get locked out of your account?
But then I got my main account taken away, I'm going to say about a year ago. Rest in peace. Yeah, with all my fault. I know.
But your girls find you.
Yes, absolutely.
Your girls find you.
And it's always me responding to all the messages. I run my own Instagram.
Yay. I love that. A lot of my plastic surgeons run their own Instagrams because they like answering the patients. They're like, I like talking to my girls.
Me too. Absolutely. And it's genuine. And it's me. It's like, oh, will you ask her? And I'm like, this is her.
This is her.
Yeah. This is she.
This is her. It's me. Yeah, I love it. Dr. Grunberg, I love having you on. I can't wait to have you back on. I think we have an episode pending on machinery after massages. So,
oh, yes.
You guys, stay tuned for that episode with Dr. Grunberg.
Bye. Thank you.
Bye. I'll see y'all next week.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for Bruise Juice, you guys don't sleep on Bruise Juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.